Well, I guess I struck gold today for my talk show because I just happen to have somebody who can kill two birds with one stone. Well, number one, we just come off of Black History Month, but coming right out of February, I'll say it right in a minute, Doc, into March. And March is Women's History Month. So the two birds concept is we have Dr. Keisha Callins with us today, but she's also a woman that deserves to be acknowledged in Women's History Month, but she's also an MD, which are those two items are very, very important to our community. So we want to talk a little bit about women's history. We're going to talk some about the Middle Georgia Medical Society. We're going to talk some about her. She doesn't like to talk about herself, but she's made such a difference in our community. And we're going to talk some about medicine and health. So it is such an absolute pleasure for me to have on the show Dr. Callins, who I have known for a while. She was on my show 12 or 15 years ago. And interestingly enough, she was on my show as a volunteer to show you how involved she is in the community for the volunteer clinic. So she's just real interested in promoting and advancing the community as well as her profession. So how you doing, Doc?
I am doing wonderful for a Monday. Thank you so much for having me on to talk with you. And we did meet last Wednesday, and so we meet again. So I'm excited. And I actually had forgotten that it was Women's History Month. I mean, this year has been going by so quickly.
Yeah, it is. It is. So let's come out and talk a little bit about yourself, and then we're going to get a little bit into women's history. But I want to talk about uh, doctors and medicine and health and wellness, which are all factors that contribute significantly to the well-being of our community. Well, tell us about Isha.
So I'm gonna go back to kind of the beginning. So I am originally from Jamaica. I'm not sure if you knew that I was Jamaican. You may know that. And my parents said that I always wanted to become a doctor, but the experience that I remember that pretty much cemented that for me was probably around age 8. I had a stomach ache, and my mom took me to the pediatrician. I remember it like it was yesterday. And she suggested that I had a stomach ache because I did not want to go to school. And so I was home, not feeling well, and I'm going to advance the story. I ended up with an emergency appendectomy, and I have a pretty nice scar because at that time, many, many years ago, they were not doing laparoscopic surgery, and so I have the scar to prove it. So ended up with emergency surgery, and the doctor said that had I waited another day or two, I would have had a ruptured appendix, and that would have been a lot more interesting. So that was one thing, but also during the hospital stay, um, I remember waking up that night. I can picture in my mind the two-piece nightgown that I had on with frills at the sleeves, and I wanted to throw up. And so I went to do this to throw up, and I couldn't move because I was gripped by pain. I had staples and the whole thing, big bandage, and I threw up all over myself. And I remember signaling for the nurse, and she said, I'm basically too busy, and you're going to have to wait for someone from your family to come in the morning to clean you up. And so I slept in my own vomit. And when I woke up the next morning, my mom had a friend who worked in the cafeteria, and she had come up to check on me and was cleaning me off when I woke up. And that's how I woke up, with someone cleaning me off. And so I pretty much decided at that point that I wanted to make sure that no child would ever not be taken care of by the doctor or by the nurse. And so I don't know why I thought that one single person could do any of that, but my sensitivity to how people are treated started very early. And there's a quote by Maya Angelou that says, people may not remember what you do or say, but they remember how you made them feel. And I remember that feeling. And that is infused into my interaction with my patients all the time. So that's what happened. So that's how it all started. So I'm giving you the original version of
Go
that.
ahead. It's an interesting story. More, more.
And so I'm going to fast forward a little bit. I finished high school in Jamaica and then came here to the United States. And because I came in the middle of the year, because we're on the British system in Jamaica, and so we arrive We finished school earlier, and so came mid-year and could not apply to college at that time. And so did an extra year of high school in New York. And then I met my social studies teacher who had just graduated from the University of Virginia. And he just talked about how great the school was. And I thought, oh, sure, I'll apply. So I applied to lots of schools, but that school actually gave me the best financial package. And I will go ahead and say that I'm the first generation everything, high school, college, and then med school. And so not having a lot of funding to support my dream of becoming a physician, that was really important. And so was able to complete my bachelor's degree, which I did in biology, and then I minored in religious studies with a focus on ethics. I applied to med school, and unfortunately, I did not get in the first time. And I will tell you, in addition to, it was double disappointment because I really was disappointed in myself because that was what I had planned to do. But the
Right.
bigger disappointment was my parents because they had sacrificed so much. They were still back home in Jamaica with my other siblings. And I really was not happy that I had disappointed them. And so I had to make a pivot. And so I had actually had an interest in public health and decided to pursue a master's in public health because that was part of my plan. And so I actually took being a doctor off the table completely. And then when I went to grad school, I went to church and met my now mother-in-law, who's a retired pediatrician, and her husband, who's now passed away, is a retired oral surgeon. And I remember the first time I met them, we went for lunch after church, and they chewed me out about the fact that I had given up on becoming a doctor. I was so upset that these people who did not know me, and my mother-in-law's Jamaican, so maybe she felt that kinship. Would just like really get into me about my decision. I actually like left and did not go back to church for a little while because I was not happy. But long story short, took a while. We became friends, and she actually convinced me to retake the MCAT and give it a second chance, which I did, and I applied a second time. While I was doing that, I actually met her son, now husband Joel, Big Joel, as I call him. And so the second time around, I was successful and I was able to get a place at Morehouse School of Medicine. And so I moved to Georgia from Alabama and have not left Georgia since then. And so it's interesting sometimes how your Hmm. Detours seem like dead ends, you know, but I've learned hindsight is 2020 to really trust the process. And it's clear to me that even though I had given up on the plan that God had for me, He had not given up. And so he found another pathway for me to pursue that. And so one of the things that feeds into is how I work with my students, especially the ones that are struggling, because I remember what it feels like to not do well on a test or feel like you're not going to make it. And so I have been pulled and pushed and assisted so much in my own career that I am very willing to do that with my students who really don't know the potential they have because the people that helped me saw the potential that I could not see at the time because I was so covered in my own disappointment that sometimes it's hard to see that. And so having that village to really support you makes all the difference. And so the doctor that I am today almost didn't happen, honestly, were it not for that direction and that mentorship and that guidance, and for me being open to, not giving up after the first time. So.
When you said students, that does that mean you teach?
I do. I do. So I'm on faculty at Mercer University School of Medicine, and I've been on faculty since I moved to Macon in 2017. And so I have a chance to do clinical teaching. The students usually come to me here in the office, and we get to, as I call it, hang out. And so everything that I do, both patient-wise, but also things I do in the community, presentations. I tell them whatever I'm doing, they get to do them. If I go to a kid's game, if my kids have a game, they go. So whatever I'm doing, they do it because I really want them to see what it looks like to practice medicine. One of the things that happened when I did get into med school and decided to pursue OB, being an OBGYN, I got a lot of feedback that was not always positive. Well, if you want to have a family, you shouldn't do that, or you should do this certain thing and not pursue that thing. And so a lot of free advice was given. And I guess my stubbornness, I'm a Taurus, I'm born in May. And so
Mhm.
when people tell you can't do something, that just kind of does the opposite effect. And so I really think it's important to have that attitude of kind of figuring out what you want to do. And so with that, I mean, I use that same attitude with my students. And so I pull them and push them and promote them. And my goal with my students is I tell them my goal is to make you smarter faster. This year is my 20th anniversary from graduating from medical school. And so I tell them what it took me 20 years to learn. If you listen to me, you should be able to do it in five. And so how do
Right.
we accelerate that process? And so I really love pulling my students forward. I'm also trying to get people to be more OBGYN, so a little selfish focus on that. But not all my mentees are OBs. They're not all even in medical school. Some are in nurse practitioner school, some are doing PA, lots of different specialties within meds. I have a couple right now who are in midwife school. And so my goal is just really to get more representation within medicine. And so it does not have to be, you know, being only a physician.
That is some concern about the relevance and importance of choosing a caretaker, a doctor. And oftentimes, and I'm glad you told that story because you are associated with a group of African American doctors called the Middle Georgia Medical Society. And I think it's important, not necessarily from a separatist angle, but from a cultural angle, you know, for particularly when it comes to medicine and health, to kind of at least have a connection with a physician that looks like you and who understands you. So talk a little bit about the medical society and the doctors and some of the initiatives. And I guess you can plug in somewhere, and I have to be careful how I say this, but interest in treating somebody, genuine interest plays a role in the kind of treatment and care that you receive. That's why you're a doctor, because you had that experience of being involved in a situation where the interest was not as prevalent
Mhm.
as it should have been.
Yep. So the I'll start out by saying that when we decide to pursue healthcare in any form, the goal is to help people help take care of people. And that should always be rooted in dignity, empathy, and respect. That should happen across the board. However, um, for lots of reasons, that does not always happen. And so I do think that it is important for us to have the appropriate representation. So I'm going to talk about that for a second. And so part of it is just really knowing what's available in the community. So the Middle Georgia Medical Society is a medical society that is focused on underrepresented physicians in medicine. And the goal is really for us to make sure that people know what's on the menu, what options are there. If that is something they want to pursue, then who is it that they would want to see? And so we want to make sure that information is public for people so that they can make informed choices. Um, but I'm going to turn that 180 degrees just a little bit because there's still only a very small percentage of physicians who are underrepresented that are in medicine. And so in order for us to meet the needs, I believe the population, it's about 33% in terms of population who are what would be considered underrepresented or minorities. But the number of physicians that would reflect that is really, I think it's less than 10%. So in order for us to get all the care, it's going to have to involve a team of people that probably don't look like you. And so I want to kind of pivot back to your question about teaching. And so I teach a wide range of students, people from across the whole state, people from different institutions. And the purpose of all of that really is to be able to try to instill all of those values, regardless of who I'm teaching, because they're going to have patients who don't look like them. So if you are a physician of color, you're going to have someone that just doesn't look like you. If you're a physician who's not of color, you're going to have someone who doesn't look like you. So we're all going to be taking care of patients. And so the goal is how do we treat or train our healthcare professionals to take care of people, not just their problems, not their demographics, but how do we help them take care of people? And so I am very happy to contribute to promoting the underrepresented physicians in our community. But the bigger issue is how do we really get people connected to care? And how do we get all of our physicians to embody the principles that we promise to do? When we get that MD and we turn that tassel, we take the Hippocratic Oath. Everyone does. And so as a professional community, we have to hold each other responsible. And I will distill it down to two things that I tell my students. Number one, take care of your patients like the family you love. I used to say take care of them like your family, but you may not like everybody, so that didn't really bode well, and I kind of figured that out early. So people you love, i.e., if you wouldn't say it to your grandmother, don't say it. Right? The people that you respect, that's your benchmark. If this were your sister in front of you, how would you manage them? What would you do? What stone would you not roll over? Would you go to the moon and come back? And that is what every patient deserves if you are in that field. The second is be the doctor that you would like to have. So all of us have had the opportunity, for the most part, or many people, of being a patient. And it is a very scary thing. A lot of us also have been advocates for family members. And so we have also seen things that worked well and things that did not work well. So I ask my students all the time to really think about that. And I will tell you one thing I see consistently in my underrepresented students, almost, I would say 90% of them had a family member that had a negative experience, kind of like mine, that propelled them into the field. So my hope is that at some point the tide will turn and we'll have more people getting into medicine because they had a positive experience and they want to duplicate that. So that balance is not there yet, but I'm hoping with time, and if I'm being, altruistic or, being a visionary, that's what I would hope is that we would turn the tides on the kind of care that people receive.
Outstanding. And thank you so much for your heart, your interest, and what you're doing. Let's talk a little bit about healthcare. I mean, I know education is a part of healthcare, and we certainly want to have a healthy community. I mean, there are other areas that we need to address in the community, but if you're not healthy, if you're not feeling good, if you're sick, you can't approach those other disciplines in the community that ought to be addressed. So, talk about the status of healthcare, and also talk about kind of advise, if you please, the community on, how both individually and collectively we could be more cognizant of the importance of healthcare and what we should be doing and how everybody can contribute not only to themselves, but to a healthy community.
So I'm going to dial back a little bit to when I gave you the history and I talked about pursuing my public health degree. And so I think that detour served me well because I went into medical school and went into my medical training with a public health mindset, which is not just about chronic disease or figuring out how to fix problems, but how do we really achieve health and well-being? And that is a concept I think we can absolutely work on in the general community, but also in our communities that are what we would consider vulnerable populations or marginalized populations or rural or underserved, any of those special categories. Um, the focus, because of lots of what we are now calling the social determinants of health, the ability to be able to pursue well-being is challenging for lots of reasons. So currently today I'm working in Twiggs County, and the nearest hospital is 30 minutes away. We have one blinking flashlight, and we have a grocery store that may have the things we need or not. But just an example of what rurality looks like and accessibility to things that have option. There's no gym that's here, right? If someone wanted to work out. And so, being able to quickly get to a place and get back requires a trip somewhere else. And so being able to navigate those difficult spaces is important. So I want to start out by saying that I acknowledge the challenges that exist that impact how some people are able to access care. Then we add on the financial component or the medical coverage component. So probably half of my patients are uninsured, but I have a lot of patients who have an insurance card, but they're still what we call the underinsured. Because if I order a pelvic ultrasound, the copay is more than they can afford. So even though they have a card that says they have coverage, I still have challenges with them being able to access the things that I would like them to have. And so just having insurance alone does not resolve the issue, right? And then you actually have to find a provider who will accept that particular insurance, and you may have to travel outside of where you live. So there are lots of challenges. So having said all that, how do we really get the community, both individually and collectively, as you mentioned, to really what I call prioritize health. So I'm going to use one example, breast cancer. We still have very high rates of breast cancer in our community. And people say, okay, well, if we get, Atrium right now has a mammogram coach that travels around different counties, and you can show up. They went to Jones County and they did the teachers. So we're starting to bring resources to communities so that way people don't have to overcome the barriers of, for example, transportation. But I counter that sometimes. I think we do have resources, but the challenge is how do we improve utilization of those resources? And my new term now is health prioritization, meaning the same patients that say, well, I need to get a mammogram have probably made a trip to get their groceries somewhere else. They've probably made a trip to get their hair done, their nails done, to get their kids to the ball game somewhere. They have made a decision about what's important, and the choices they make and what they do with their money reflects their priorities. And so our challenge is how do we get health to jump in the rank list? So if I can do all those things for my child who needs to go to football an hour away, or if I can do this to make sure they have this certain food, then how can we get people to think about their health in that same way? Because we are making choices. We are doing things that we want to do. And so I think the bigger issue is health priority so that we're doing things that help us prevent disease, number one, or identify things early. And that's the thing that I struggle with. And unfortunately, because of the challenges that I mentioned before, some people are only going to tap into the healthcare system when they have a problem. Like they've had it for a while and then you come. And so you haven't had a chance to really prevent that thing or address it early enough. The way that shows up in ways that are difficult is just usually with cancer, where people have had an issue for a while. And I've had patients who have had irregular bleeding, postmenopausal, I mean, they should have stopped cycling or they did, and then they start again. And because they don't have insurance, they don't know what services are available, then they delay access to care. Then by the time they show up to the emergency room, things are advanced. Now, so what I would love for us to do is to really, I used to say, be your sister's keeper. Then I said, be your brother's keeper. Now I say we all need to be community keepers. And so I should be able to say to you off camera, Mr. Habersham, have you had your prostate checked? Miss Andrea is here recording. I can say to her, hey, have you had your mammogram? Have you had your pap smear? How do we develop a community? We talk about everything else. We talk about the news. We talk about shoes. We talk about, you know, all kinds of things, social media. So why is the health conversation not also a part of that? And I think a place of impact, for example, is in our civic or faith-based organizations where that's where people are. So what if each congregation, for example, adopted a report card where, people could decide if they want to participate, and we do an assessment with a trusted professional. Most congregations have a health professional. And if people have not done what they need to do, then how do we make sure that they get the appointment? Or if they're having trouble accessing this resources, then the transportation or the coverage. There's so much available. Like in our state right now, the health department, for example, is a wonderful resource. Pap smears are available. You can get your breast exam and get a voucher for a mammogram. No one should be without a mammogram if they don't have insurance, right? So again, it's not just the resources, but how do we improve utilization of resources? And then furthermore, how do we get people to prioritize their health? Checking your blood pressure. Every home should have a blood pressure cuff. Everyone should know what their numbers are. And if your head is hurting and you're not feeling well, what happens is, and do have, families where they're working one or two jobs and they're doing the best that they can. But what happens is the people that are in charge of their family, if they go down, everybody goes down. So it's almost like you can't afford to not prioritize your health, right? I mean, we have to do that. And so I think there's room for improvement in terms of being able to just get more frank in our conversations. And I just don't think we do that enough. I mean, I've had a couple friends in the past year that have had breast cancer, and I'm an OBGYN, right? So I was thinking, well, should I have asked them, have you had your mammogram? I should, right? I should get nosy with intention. And so I just think we can do better with each other. in terms of that care. And I think we could manage a lot of chronic disease in that sense. And the last thing I'll talk about is really, your food is your medicine. And I tell my patients, if you eat trash, your body is not going to work. So how do we really confront our choices that we make, right? And so my patients know I fuss about things all the time, but we have so much generational trauma and stress already that if we don't do something to break the cycle, then we're really compromising the quality of life that we have now. But also, more importantly, like I tell my grandmas, your grandkids need you. The young people don't really know what they're doing. And so they really need you to be present. And that's how I usually get my grandmas to stop smoking. Because when they realize that if they're not present, who's going to really take care of those grandkids the way that they do? That's the game changer. And so the last thing I'll talk about is just looking to the future, who's depending on you. And that usually is the leverage that I can use to help my patients make a different choice. They may not do it for themselves, but when they think about their family, so like I tell my moms who are diabetic, if you go to eat something like that, some ice cream, you ask yourself, is this going to keep me here for my son or my daughter? And somehow that mindset shift changes their decision for the most part and is an opportunity. So when we start to think not just about ourselves, but about the people that depend on us, especially for our women, for the guys too, but I just think we can really do a little bit better in terms of prioritizing our health and then access to resources.
I don't want to finish this conversation without talking a little bit more, maybe do a solicitation for individuals who are physicians out there. Talk a little bit more about the Middle Georgia Medical Society. It has been around a long time. We need to acknowledge Dr. Hutchins, who has been
Absolutely.
the
Our
executive
founder.
director for a long time, and then maybe do an appeal to other physicians or whoever can join.
Mhm.
So just give us an overview of the society because I think it's extremely important to the community.
I think one of the most important things about being a part of a medical community is the collegial support. We are in a very difficult landscape when it comes to healthcare right now. And things just don't feel as difficult if you're not bearing the burden alone. And so there's
Right.
a professional benefit to community. We had a session in the month of January where we had a guest who presented a program. It's called Randomize Now, and it was just talking about engaging more physicians in clinical trials. And we had a great meal. We took a picture. And I think everyone left feeling very energized. And so I want to make an appeal for that connection. But the last thing is if I have a patient who comes in and they have a kidney problem, if I'm an OB/GYN, I need to be able to pick up the phone and call and say, hey, I've got a patient who needs something. I did that
Right.
recently with Dr. Emerly. I had a
Right.
patient who needed to get in for cardiology. So
Right.
there's a patient benefit, but there's also professional benefit.
That is so awesome. Thank you so much for all you do. And then we will flash Georgia Medical Society website up on the screen. And, I know that you want all physicians and healthcare professionals that's eligible to join
Mhm.
to become a part of the organization. This is a call to action. I'm your host, Alex E. Havisham, having interviewed Dr. Keisha Callins, she's an OBGYN, she's a public health professional, she's a community activist, so I could put a lot of initials behind her name because of her involvement. But I certainly take my hat off to all that you are doing in the community. Continue doing that and wishing you Godspeed and all that you do and just keep on doing what you're doing. You're making such a difference in our community, and I'm deeply appreciative. This is a
You're
call to action.
welcome.
I'm your host, Alex Habersham. Have a great day.
www.makingblackpages.com